In this video, we will show you how to care for your baby's exposed bladder. When your baby is born, the doctor will cover the exposed bladder to help prevent irritation. Because diapers can also cause irritation, you should always keep a transparent adhesive dressing, such as Tegaderm, over your baby's bladder to optimally protect it. This dressing does not need to be changed with every diaper change or even every day. It only needs to be changed if it is falling off, not covering the bladder enough to protect it, or when it gets dirty from stool or poop. Change the dressing on a flat surface like a changing table or bed, or at a slight angle with your child's head raised. Watch your child at all times while changing the dressing to keep them safe and make sure they do not fall. It is important to gather all of your supplies first. You will need a transparent adhesive dressing like Tegaderm, a thin skin barrier adhesive like Duoderm Extra Thin, mild soap such as Dove, Johnson & Johnson, Aveeno, or Ivory, and water or 0.9% sodium chloride solution, saline, a 60 milliliter catheter tip syringe, gauze, tissues, or a soft towel, a baby bathtub, and a bowl for the soap and water mixture. Be sure to wash your hands thoroughly with soap and water before changing the dressing. Next, remove the transparent adhesive dressing by carefully and gently pulling it up and away from the skin. When the dressing is completely removed, look to see if the skin around the bladder is intact, clean, and dry. If the skin is red, moist, or cracked, gently clean the area with water and call your care team. When the dressing is removed, you may see a light red outline of where the dressing was stuck to the skin. This may mean that your child has skin sensitivity to the sticky part of the dressing. If the redness doesn't go away, please let your clinician know so they can help evaluate. After removing the dressing, place your child in a bathtub full of warm water. It's okay for the exposed bladder to go underwater. We recommend, if submerging, to use plain water in the tub and have a separate bowl of soapy water nearby to use for cleaning. If the skin around the exposed bladder is dirty, use a soft, clean cloth or gauze to soak up any urine or poop. Then wash the skin with soap and water. Be careful not to rub the bladder directly. You may see a small amount of blood if you accidentally rub the bladder. That's okay and is normal of the delicate tissue. But if you're worried, please take a photo and call your care team after you finish the dressing change. To clean the bladder, use a 60 milliliter syringe, bulb syringe, or baster to gently squirt water over the bladder and flush away any poop or mucus. It's also okay to pour water from a cup or pitcher to flush the area. When choosing between a small or large dressing, the goal is to cover the bladder completely so the adhesive sticks to the skin above and next to the bladder. This allows urine to funnel down into the diaper and not onto the inner thighs. There's no one-size-fits-all dressing, and you may be required to cut a large size down to more optimally fit. Start by aligning the Tegaderm removal tabs at the top above the bladder, just below the umbilical cord if possible. It's okay if you cannot separate the bladder from the umbilical cord. Cover them both under the dressing. Keep putting the dressing on one side at a time. It's okay to gently push the bladder to the right or left if it helps to tuck the dressing to the skin around the bladder more snugly. Keep going on the other side until the dressing covers the entire bladder. At the bottom of the dressing, by the genitals, make a small tent in the dressing to let urine pass easily into the diaper. Do this by pinch pleating or sticking the edges together. Another way to do the dressing, for those who may have difficulties with adherence and, importantly, for those babies with very sensitive skin, is to cut a Duoderm Extra Thin bandage in a horseshoe shape and place the horseshoe on the skin above and to the sides of the exposed bladder. If you need to use the Duoderm Extra Thin, try to line up the transparent dressing with the Duoderm Extra Thin in a way that will limit skin contact. Now close up and fasten the diaper the way you normally would. Check and change the diaper regularly throughout the day to lower the risk of diaper rash. If your child has a diaper rash, we recommend using diaper cream on the rash area only. Do not put diaper cream on the exposed bladder tissue or close to it. call your care team in case your baby's diaper rash requires further medical treatment. Please seek medical advice through primary care or your urology care team before starting diaper rash treatment around the diaper area or bladder. If the dressing does not fit over your child's bladder and genitals, if your baby does not pee in their diaper for more than 2 hours, or if your baby has a fever or is throwing up. Have questions? The team in Boston Children's Bladder Exstrophy Program has answers. Please contact us for more information.